COVID-19 self-test using a lateral flow device LFD kit. What is inside a self-test kit? The NHS Test and Trace self-test kit contains packaging, extraction tube holder, instruction booklet, extraction tubes, waste bags, swabs, lateral flow device test strips, extraction buffer sachets, but some kits are different, so always check and read through the enclosed instructions. How do you do a self-test using an NHS Test and Trace COVID-19 self-test rapid antigen test kit? Please note, if you have problems with your hands or vision, you may need someone to assist you with the swabbing and testing process. Avoid eating or drinking for at least 30 minutes before doing the test to reduce the risk of spoiling the test. All items in the test kit can only be used once, so please do not reuse them. You will need to report your result each time you take a test. Children under 12 should be tested by an adult. If you are testing a child under 12, there are slightly different guidelines. So please refer to the information booklet within your self-test pack. Before unpacking the test kit contents, you should clean the surface you are going to use. Open the packaging and lay out all items in front of you. Once the self-test kit is unpacked, place in front of you one test strip, one extraction tube, one extraction buffer sachet, one waste bag, one swab, and the extraction tube holder. Read the instruction booklet, ensuring you have all necessary testing equipment and that you understand the steps for the test. Before opening an individually sealed test strip, sanitize or wash your hands. Take the test strip out of the sealed packaging. Put the extraction tube into the cardboard vial holder. Twist the top of the extraction buffer sachet fluid and squeeze the fluid into the extraction tube. Be careful to avoid touching the sachet against the tube. Put the sachet into the waste bag. Gently blow your nose into a tissue and throw the tissue away. Then afterwards, wash or sanitize your hands. Find the swab in the sealed wrapper and identify the soft fabric tip of the swab. Open the swab packaging at the opposite end of the soft fabric tip. Do not touch the soft fabric tip of the swab. Now, you need to hold the swab between your fingers. Open your mouth wide and rub the fabric tip of the swab over both tonsils, or where they would have been if you've had them removed. Do this with firm contact, 4 times on each side. Make sure that the fabric tip of the swab does not touch your teeth, tongue, gums, or face. Put the same swab into one nostril until you feel some slight resistance. Insert about 2.5 centimeters or about 1 inch. This may feel uncomfortable, which is normal. However, do not insert the swab any deeper if you feel pain or strong resistance. If you have a nose piercing, swab the other nostril. If pierced on both sides, remove the piercing on one side before swabbing. Roll the swab 10 times slowly along the inside of the nostril. If you have had a nosebleed within the last 24 hours, swab the other nostril or wait 24 hours. Pick up the extraction tube into which you have poured the fluid from the sachet earlier. Put the swab into the fluid and press the tip of the swab against the edge of the extraction tube with force. Whilst doing so, rotate the swab around the tube for 15 seconds. After 15 seconds, pinch the extraction tube against the swab as you remove it, making sure all liquid is removed from the tip of the swab. Put the extraction tube back into the extraction tube holder while you dispose of the swab into the waste bag. Press the cap tightly onto the top of the extraction tube to avoid any leaks. Gently squeeze 2 drops of fluid from the extraction tube onto the specimen well on the test strip. The specimen well is marked on the test strip by an S. Check the time and then set a timer for 30 minutes. After the timer is set, you can now dispose of the extraction tube into the waste bag. Make sure you wash or sanitize your hands after completing the swab and testing process, and after handling any waste. Waiting the full 30-minute development time before you read your result is very important. A positive result can appear at any time after 20 minutes. However, you must wait for the full 30 minutes to record a negative result, as the test line, T, may take this long to appear. You will see the control line, C, begin to develop after about 4 minutes. You must wait 30 minutes before your result is ready. Do not leave the test to develop for longer than 30 minutes, as this will make the result void. The test strip should show one of these results. How to report your result. You must report your results to the NHS. You can register your result at www.gov.uk/report COVID-19 result, or by telephone 7 a.m. to 11 p.m. England, Wales and Northern Ireland on 119, free from mobiles and landlines. Scotland on 0300 30 32 713, charged at the standard network rate. The fastest way to report your result is by using a smartphone to scan the QR code at the top of the test strip. If you do not have a smartphone, you can record the result using the ID number below the QR code on the test strip. If reporting the result online, follow the on-screen prompts. Once you have reported your result, dispose of your used test kit. Pack back into the test kit packaging the things you did not use, and clean the area you used to conduct the test. Please visit the Norfolk County Council website for more information at www.norfolk.gov.uk/care support and health/health and wellbeing/adults health/coronavirus.